Hi, my name is Dr. Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today, I want to talk about your oral cancer exam. So we go to the dentist every 6 months to get our teeth cleaned and our teeth checked. And in that exam, the dentist should be doing what we call an oral cancer exam. Now, you may not even know what's going on, or you may not know exactly what the dentist is looking for or what they're doing, so I thought I'd talk about it a little bit with you. An oral cancer exam is a very important thing to have done. Even patients that don't have their teeth any longer, that are wearing dentures, should go back to the dentist at least once a year for a good and thorough oral cancer exam. When the dentist is doing their oral cancer exam, most typically, they're feeling along the outside of your neck, feeling your glands and your lymph nodes to make sure there are no lumps or bumps that shouldn't be there. They know how to detect this, they know what they're feeling for and looking at, and so they can tell if there's something that's abnormal. And if there is, they would stop and talk to you about it and tell you what they thought needs to be done next. Then we look inside of the patient's mouth. Not only are we looking at the patient's teeth, looking for any cavities or checking their old fillings, but we're also looking at the soft tissue, your tongue, the back of your throat, the roof of your mouth, along the gum line, in between your, underneath your tongue and in the inside of your cheek. We're looking for discolorations, redness, whiteness, swellings, painful areas. So we might push and prod a little bit and poke around and look. And all that time, what we're looking for are things that don't belong there. One of the things that you can do in conjunction with making sure that you go every 6 months to your dentist for your checkup is to pay attention to your mouth when you're taking care of brushing your teeth in the morning and in the evening. So it's more than just sticking a toothbrush in your mouth with some toothpaste in it and finishing up with some flossing. You should pay attention to the way your gums look, to the way your tongue looks, to the way the inside of your mouth looks, so that you can keep track of any changes that might be needed to be told to the dentist. So that when you go to your dentist, you can say, you know, I've noticed such and such happening along the side of my tongue or on the inside of my cheek. Those things are very helpful. You are your best detective. You are the one that knows yourself the best in your entire health, in your entire being, and certainly the inside of your mouth. So make sure that you keep those every 6-month visits with your dentist so that not only are they checking your teeth, but they're also checking for an oral cancer or any oral soft tissue discrepancy, something that doesn't belong. There are some easy things that we as general dentists can do if we suspect that there's something that's just a little out of the ordinary. Our office does what's called a brush biopsy. It's a simple first stage kind of test where we take a sterile brush and scrape off a few cells in an area that we would be suspect of, and we send it off to a reputable lab and they can test it to make sure that it's just nothing. And most often, it's just nothing. But it's always very reassuring to know that there's nothing harmful going on in your mouth. If there's something that's a little more concerning to us, we might suggest that you go to an oral surgeon that we would refer you to. An oral surgeon may take a look at an area that's suspicious and do a more definitive biopsy, and they then can reassure you that everything is okay. Chances are things are okay, but you always want to make sure, especially if you have a history of tobacco use, whether it's tobacco chewing or smoking, you want to make sure that anything that is found in an oral cancer exam is followed through on to make sure that it's nothing more than just a little or out of the ordinary patch. So once again, on your end of things, you can check your mouth on a daily basis and keep track of it and note if there's anything that's different, and call your dentist if you are concerned. Even sometimes when we get a canker sore, if you get a cold sore and it seems to last a little bit longer than usual, don't ever worry about calling your dentist. It's a good thing to call and just reassure yourself that everything is okay. If the dentist wants to have you come in, go in, have them take a look at it. And then every 6 months for your regular checkup, Make sure that your dentist is doing a thorough oral cancer exam, starting on the outside of your neck and your outside of your cheeks, working their way inside in the lips and the tongue and looking down your throat, just to make sure that everything looks the way it's supposed to. So that's what I wanted to talk to you today about, is an oral cancer exam. An exam that you probably have every 6 months, and maybe you just didn't know a lot about it, what we were looking for. If you have any questions, please feel free to call us at our office or email me at info@parkridgedds.com, and I'd be happy to answer your questions. And remember, as always, we love making you smile.